What's going on, everyone? I'm here with Dr. Ed LeCara, who is
Up, guys?
a longtime friend and functional movement mentor of mine who I turn to when I have difficult questions because he seems to know all the right answers. He's someone that I met several years back, and I'm gonna share this real quick to a couple spots on Facebook. So give me a sec. But hey, Dr. Ed, while I'm doing this, do you want to just give everyone a little bit of a background of who you are, the fact that, well, I guess like first and foremost, you'll be here at our upcoming Impact event. That whole event's a 5-day event from February 17th through 21st. You're here on the 21st and pretty much taking that entire morning, closing out with clinical. So back to you on who you are, what you're going to cover, and I'll do my thing.
Yeah, sure. Thanks, Todd. Yeah, so you and I met, I don't know, gosh, it's been probably 2014 when I taught a rock tape class up at your facility in Boise. And we had a lot of, we were just like kindred spirits, right? It was just, I was talking a lot about using tape in a way to influence movement patterns more so than activating specific muscles or inhibiting certain muscles because the body works in such a dynamic way. It's too smart for us to try to dissect in anatomical terms what exactly is doing what. With a single movement, there's 1,000 things going on in the system, and although we learn anatomy, hey, biceps brachii does elbow flexion, and a secondary movement is shoulder flexion, and that's how we learn stuff, but that really is not what's occurring in the system. And you and I just kind of started geeking out on a lot of this stuff about how important it is to really be identifying movement patterns versus trying to find out the pathophysiological cause of pain and dysfunction. And so really that initial introduction for me, I mean, my background, I started off as a frontline medic in the Army. And so my mindset is getting people back to activity ASAP, because that's what our job was. It was, put a Band-Aid on it and get them back out there safely, of course, as safely as we could. And that has just carried over to my life as a licensed and certified athletic trainer, as a chiropractor, as a certified strength and conditioning specialist. Um, and along the course of my education, I've got board certification in sports medicine, board certification in rehabilitation. My PhD is in sports medicine. I was really, really frustrated in clinic because in reality, I know that most people get injured due to the fact that their capacity is at this level and they're asking their body to do this. And this gap occurs between demand and capacity, right? As long as we keep the demand below our capacity, we don't get injured. Once we exceed that demand, whether it's repetitive type motion, cumulative trauma, or it's an acute injury, um, the demand has to change or the capacity has to change in order to do the activities that we want to do. So the frustration for me early in my career, probably year 6, year 7, year 8, being an exercise physiology undergrad, understanding that, hey, in order to truly cause change in people's capacity, we've got to make them bigger, stronger, faster. I didn't really have that opportunity in the clinic. I mean, I typically get, and back then I was insurance based in California. I was, I was getting about, on average, about 6 to 8 visits for an episode for somebody. And it just wasn't enough time. We know that true strength and hypertrophy occurs at right around week 12 to week 18. We have a little neurological adaptation earlier on at about week 3 or week 4. But true strength and hypertrophy doesn't occur until way down the line. I wasn't seeing patients long enough in order to cause those types of changes. What I would have to do is get people out of pain, improve their movement, and then send them to their strength and conditioning, their athletic trainer, their personal trainer, their CrossFit coach, whoever it was, and they were going to have to gradually return them back to as much activity as possible. But it was kind of out of my control. So my thought process was, well, why am I giving people strength and hypertrophy protocols when possible early on? Instead, if it's going to take so long, early on, I might as well just improve movement patterns, because I don't have enough time with people to truly cause change in capacity. So I switched my mindset from a strength and conditioning, get people bigger and stronger, to fit the insurance model, which was more of, hey, let's get you out of pain, let's try to improve your movement. And those exercises changed a lot for me. It's the difference between doing a heavy deadlift versus, hey, somebody can't touch their toes and I've got to restore the normal toe touch movement pattern, is a big difference. But I stopped beating my head up against the wall and started just doing these movement-based corrections. And then all of a sudden, doing this after 5 or 6 years and using selective functional movement assessment and the functional movement FMS, the functional movement system, and being NASM certified in corrective exercise, and using a lot of this corrective exercise strategy, I stumbled upon blood flow restriction training. And what really hit me about blood flow restriction training is, unlike normal training where we thought we had to break down muscle tissue in order for the body to adapt to that stressor, we found out that if we create a little bit of hypoxia in the tissue, we can recreate high intensity exercise without actually having to do high intensity exercise. We can increase strength and hypertrophy in as little as 3 weeks versus having to wait out 12 and 16 weeks. So I'm able to use strength and hypertrophy protocols using blood flow restriction training within my normal insurance-based progressions. Now I'm all cash-based now, so I just kind of incorporate it into my different systems. Like you'll see me back here, I got my suspension trainer. I've got essentially like a dual cable crossover system. In order to do that, I've got small amounts of dumbbells here in my left corner behind my shoulder, but that's all I need, because when I use blood flow restriction training, you can't use heavy loads, nor do you want to. In most of my cases, we can't use heavy loads early on because we will cause more damage to the tissue. With BFR, we don't cause more damage, but we get the adaptation effect of doing high intensity training. So now I'm combining both. I'm saying, okay, listen, my goal number 1 is to get you out of pain. My goal number 2 is improve your movement patterns. Those two kind of overlap and happen together. Goal number 3 is to bridge the gap between my capacity and my demand, right? Bridge that gap. So now I've got a higher capacity and hopefully exceed what my prior capacity was, in order to allow people to do what they want to do. So where I live right now in Dallas, Texas, I've got a lot of people that belong to country clubs and play lots of tennis and lots of golf, and they might play tennis 4 or 5 days a week. Well, lots of lateral epicondylitis, lots of shoulder injuries, lots of knee and Achilles and calf and these things that I treat. And the brain is asking, and so I need to improve that capacity over time. So I'm using different techniques in order to, again, get people out of pain initially, because that's why they come and see me. They don't come to see me just to say hi. It's, hey, I'm in pain and I need to improve my ability to perform, improve their movement patterns that probably led to the injury in the first place, then improve their capacity over time so that they can tolerate what their body is being asked to do. And they don't have to be athletes. It could be grandma trying to pick up their 26-year-old grandson. It could be somebody trying to do their work. It doesn't really have to be specifically an athlete. I just tend to connect more so with athletes because of my history. So when I come up to impact, I have 3 hours, so I don't have enough time to kind of go through multiple body parts, but I'm going to show what I use for the shoulder, looking at functional movement, combining it with some orthopedic testing and some other things that, you're a big proponent of, trying to figure out pathophysiological cause of pain to maybe rule out, do I need an MRI? Do I need X-ray? What is my long-term prognosis? But then apply movement-based corrections and then stabilize that improved movement pattern with improved strength and hypertrophy over time. So it is a continuum. They all kind of work independently. And if you're new to practice, like I have a couple interns now, and I tell them, like, listen, in the beginning, I'm 21 years into this. Like it's not like this all of a sudden just hit me and, I'm able to perform these things, choose what boxes you want to work in. And it doesn't matter if you're a strength coach and you want to work at one end, you're new to practice and you want to work at the front end of just really getting people out of pain and then moving them on to the next box, or you want to do all three when you feel comfortable, like I like to do. Because for me, it's really gratifying to take people all the way through the continuum. That's why I love being an athletic trainer. We're on the field. We treat people on the field. We bring them back in the athletic training room. I get them going all the way through performance and working with their strength coach. So I like working along all those lines. But really, what I want to talk about up there is you can play a role in any one of these boxes. It just really depends on what your personality is like, what your experiences are, what you feel comfortable with, what you like managing. Because I'm a firm believer in you got to do what you love. Otherwise, you get burnt out really, really quickly. And I love doing this stuff. I mean, to be able to not only do it, but then take what I learn in the clinic. I treat patients on a daily basis and bring it up to some place like yours and be able to share my experience and then learn from everybody in the audience. Like, hey, what do you do for this? What do you do for this? What do you do for this? Because I always end up learning more at these things based on what the crowd has done than what I'm actually bringing to the table. So super excited about putting this together for you. And yeah, it's gonna be super fun, but we're gonna focus on the shoulder, movement-based assessment, a little bit of orthopedic, but really get our hands dirty. I know they'll have been there for a long time, so they're gonna be tired.
Sure.
So the best way to kind of keep people engaged is, hey, let's get our hands on people. And here's some different techniques that we use. I'm gonna try to introduce blood flow restriction training for those folks that haven't seen it. I'm gonna introduce some tooling that I do. I'm gonna introduce some cupping, movement-based cupping. I'm going to show some video on using shockwave that I use in the clinic for tendons. So lots of different things. And then our hands-on, some active release technique and some other techniques that I use for the shoulder. And then finishing all that with how do we stabilize the joint now that we've improved their range of motion. I do that with tapes. I'm going to show some taping techniques I like for the shoulder and then progress that into from corrective exercises and then kind of briefly introduce like how do I then incorporate more intense work, either with BFR or without. So that way it's a gradual progression all the way back to your normal activity or even above that. If we improve your capacity, we should now be able to increase demands on the body without causing injury. I just talked way too long.
No, it was good. It was good. And things, as you were talking, things that I was thinking of is the feeling that it created back when I first took a seminar from you, Ed. So back when I was student and you were teaching and I was sitting back watching you teach, and I had this feeling inside knowing that what you were saying is true and I wasn't doing it for my patients. It was true and I wanted to do it because I always saw myself as a really caring top level clinician, and I wanted to be able to deliver for my patients. And I was torn because what you're saying is true. I wasn't doing it. And I'm trying to figure out, well, how do I do it in this model of chiropractic that I do, which is different than your model of chiropractic. However, we're both addressing functional movement and functional rehab and doing it kind of in different ways. And there's many different ways to do it, but there is like multiple techniques. And like as far as what we do in Move Now is really all the systems to actually help a chiropractor execute this stuff. Right. So like learn it, get excited about it at a seminar, but then figure out, okay, well, how am I going to do this with my 40 patients that I've scheduled on Monday? Like, how is my staff going to do it? How am I going to leverage my time? Am I going to have to totally change my entire clinic, or can I make it work? Can I hire another person? Can I have systems and education and things in place so patients get it? But yeah, I mean, like right there, as far as what you were talking about, as far as someone's capacity and their demand, I think that's a really cool thing because it's so clear. It makes sense. That was the same kind of clarity I had back when you were first speaking. I mean, I think back, honestly, I think I met you because I took seminars from you at multiple other places. And then it ended up you coming and doing a seminar for us specifically at our clinic for us and local chiropractors. But from that, I mean, there was a history before that where I followed your stuff. I watched you. I met you through some rock rock tape seminars, I believe. And truly, that's what motivated me to go through and do FMS and SFMA and start learning all of this stuff. I mean, it all started from sitting through a seminar that you were teaching, and it really changed the entire way that I practice because, I was doing segment and I was doing posture. So I was doing segment, I was doing posture as far as like curve correction. I wasn't doing anything with measuring movement or fixing movement. And I was just, I think, trying to like lie to myself to think that you can address segment and posture and the movement thing just magically fixes itself,
Sure.
which it absolutely doesn't. So,
Right.
right.
Well, the cool thing about what we do is that we see immediate benefits to movement patterns. I mean, we see it. I mean, I test, and what I'll show is that I pre-test everything, and then I post-test everything that I do. So within a session, I might not have a established patient re-examination for 4 weeks, but I'm retesting between each session. That's what I love about some of these movement screens that we do, is that it can be very, very quick. Once you've done it enough, you already are anticipating what's going to happen, what you're expecting, which then gives you a clue like, this isn't quite right. Like there's something wrong here. Like for example, last week I had a gymnast come in with what looked like kind of some medial epicondylitis, and just it just wasn't right. Like it didn't respond the way that I would normally expect it to respond. And so, you have to have a conversation about, hey, something's not right here. Let's get an x-ray. And it ends up, she has a growth plate deformity. So when you're testing and retesting, like the way that we do, and you create these patterns of how people respond, it keeps you honest with what these outcomes are expected to be. And you do right by the patient, because if they're not responding correctly, in a reasonable time period, you can make the right, at least in my opinion, the right recommendation, which might be more imaging. It might be getting a second opinion from my pain specialist that I use. It might be, saying, hey, we need an extra couple of weeks here. It's just not responding the way that we need, or we need to make a change in your diet, or it's too inflammatory. You're not getting enough sleep. You're under too much stress. There's other things that are contributing to this. And it's worthwhile from a practice standpoint, because you're always feeling like you're making changes in people's lives that are truly life-changing, I guess. I mean, they're able to get back to the activities that they want. I mean, we as a society being deprived of the things that we want to do for the last year. You can imagine how I felt when I tore 3 out of 4 ligaments in my knee wrestling in college. And all of a sudden I went from 6 or 7 hours a week a day of training with my teammates, to then being cut off and not being able to do that anymore because of my injury. And so many of my patients are that same way. Like, I like to play tennis. It's my social outlet. It gets me away from my work and my family to get my private time and do my own thing. And I can't do it right now because I've got this shoulder problem. And being able to allow them to do what they want to do. And we all understand this, as I alluded to, due to COVID, because we've been all deprived of things that we want to do, whether right or wrong, whatever your beliefs are. When you're truly limited, not because, hey, I just don't feel like it, but because I just can't do it, it really alters your psyche, your emotional state, your affecting then your physical state. So really getting people back to activity, keeping them active, keeping them healthy. Now I'm no longer just a pawn in their life of doing a specific modality. Now I'm a trusted coach. I'm a trusted doctor. I'm a trusted whatever you want to be in their life. And it's our relationships that we make with our patients are, I mean, we're friends more than we are, patient doctor. We're because they know you have their best interest at all times, and trying not to make all the outside, insurance and payment and all this other stuff, which is real world, but influencing and confounding, what they truly need in order for them to be healthier and live a better life. And I don't know how I got off on that tangent, but I guess I won't.
No, it's a good tangent. It's a good tangent. This is actually a side of you I haven't seen before, but that's good. No, so look, everyone out there, if you haven't heard of Dr. Ed here, he's someone that's pretty well known in this space in chiropractic. there's many people that I've met over the last several years that I mentioned your name, Ed, and they're like, oh yeah, I know him. Yeah, I met him at this seminar. Cause like at one point you were teaching like 40 plus times per year or something, weren't you? Like you were traveling like crazy all over the place.
Yeah, I was
Right.
internationally. It was for a couple of years there. It was like I remember getting a I used TripIt for my trip, trips and stuff, like, and it tracks, and it was like last year you flew, like, I can't remember, it was some crazy number, so many crazy number of nights in a hotel. Like it was just it was like, oh my God, I traveled like 40. I had 40 trips last year or something. I mean, I have toned that down quite a bit. And we were forced to with COVID. We were supposed to teach about 250 blood flow restriction training courses last year. Not me personally, but me and my I have about 20 folks that teach for me and with me, internationally. And, that went to essentially zero. I think I saw the numbers. We did 19 courses last year.
Mm.
And so, yeah, I've been grounded due to all this. Luckily for technology like this, we can still be in the education space. Everybody still needs continuing education. We still need to advance our knowledge base and learn. But hopefully we'll get some of this back now. And
Yeah, for sure.
I can get back out there because I truly love, I learn more. I mean, it's like if you look at my desk here, there's constant journal articles and things because I'm trying to research and make sure that I'm bringing the best, most up to date information to the people that I'm teaching to, which makes me stay current, which then makes me a better provider, right? It's like it's dual purpose. And unfortunately, I've got opportunities to teach at the universities and teach, in private sessions and private courses, and so and people ask me other questions that I don't necessarily cover, so I've got to research those. So I just try to bring value and make it fun and not too serious, and learn from each other, and you know, provide better value for our clients and patients.
Cool. Awesome. Well, everyone out there, there's two ways that you can come out to this. You can come out in person. And so if you go to impact.movenowyou.com, it's still not too late. You can still get a cheap plane ticket. It is Wednesday today. It starts in 1 week, and the airlines are wanting your business. So you can buy plane tickets and still get them for less than it would have been prior to all this. And if you can't make it out live, and if this is the first time you're hearing about it, we are doing a live stream. So we actually hired a crew to come in. I met with them for like 3 hours on Sunday, just planning out all the different shots and where we're going to be. And I have to meet with them again this week to go through all the testing, but it's going to be pretty cool. They'll be there filming this, front row seat. So if you want to watch this with you and your staff, your team at home, or like in between patients, you can sign up and you can watch the live stream. You can ask questions at certain points at the end, and we will answer questions of people who are on the live stream. So you can have that level of interaction as well. And then we even have an option where about 2 weeks after this live event, we'll have all the recordings of everything that you'll be able to get access to as well. So if you check out the other link that I put on this description here, it goes to a page with a brief video of me explaining the different options to do this. It is a fee for this because there's a fee for us to have this crew come in and do it, and it's going to be awesome material to really get all of you chiropractors exposed to these people that are coming out to this impact event. And one of them, who is just one of the top-notch guys, again, that if I have a question I turn to, is Dr. Ed, as far as anything clinical, movement wise, research wise. It's been a little while since I've reached out, but there was a time that I was texting and reaching out constantly. Hey, do you have a paper on this? Or what do you refer to on this? And he would always come back with some kind of answer and some kind of knowledge source, which was appreciated. So anyway, I was trying to make this about 15 minutes. We're a little bit over. So I guess we will see you next week. Dr. Ed, any closing words?
No, I don't think so. Yeah, I appreciate it, and look forward to it.
Cool. Awesome. All right, everyone, over and out.
All right.